Good evening, and thank you for joining us tonight. I'm Molly Hudson.
And I'm Adam Kruger. Mary Nelson has the night off. Well, medical ethics were up for debate at the legislature this morning as a new bill is looking to protect doctors who refuse to perform certain treatments.
3 News Now's Alex Whitney brings us the latest from Lincoln.
When making medical decisions, doctors often utilize a standard of care or best medical practice for deciding the best course of treatment for a patient. But there are some cases where a medical practitioner, through changing circumstances or their own judgment, feels they can't perform or prescribe a certain treatment. And a new bill wants to make sure their right to refuse is enshrined in law.
Among other things, it provides that a medical practitioner, healthcare institution, or healthcare payer has the right not to participate in or pay for any healthcare service which violates such persons or entities' conscience.
LB 810 would protect healthcare workers who feel they would violate their own conscience through certain medical interventions. That means if a pharmacist doesn't support the use of contraceptives, they could refuse to fill prescriptions for birth control. A nurse who doesn't support vaccines could refuse to administer them. And a doctor who isn't supportive of a patient's personal relationships could refuse to prescribe Viagra if they think the patient isn't using it with their spouse.
I hope you can see, even if you don't agree with my decision, where my conscience came into play in these two situations. One in which a gentleman was using the Viagra for prostitution, and the second one in which he was using it to have affairs.
Opponents, which include the Nebraska Medical Association and Nebraska Nurses Association, argue that while a conscience needs to be respected, there is a limit. They say medical practices are already accommodating of doctors with objections based on conscience, and that the bill would put an undue burden on providers who would be forced to limit their patients' access to certain treatment options or risk a lawsuit.
Vaccine arrives in, let's say, a box at the hospital. Anywhere along the line, someone could say, I have a conscientious objection to this vaccine. I may not unload it. I may not take it to the pharmacy. The pharmacist may not fill it to the syringe. The nurse may not administer it. So potentially this bill impacts our ability to really deliver great health care.
The wide scope of the bill was also concerning for some who felt it would give doctors the green light to discriminate against certain populations, in particular those who are seeking reproductive care or LGBTQ patients.
It could be about people who need IVF for infertility. It could be about people who need HIV prevention medications if they're sexually active adults. And that's really about the person and not necessarily about the service.
In Lincoln, Alex Whitney, 3 News Now.